Hi guys, welcome back to the channel. My name's Naomi and today's video is going to be kind of like a welcome to the world Mr. Monroe, and I'll do a kind of like pregnancy and birth story, how we came about finding out he has congenital heart disease, things like that. So it will be a wee bit of a chatty one. I'll try and kind of keep it straight to the point. So this was a planned pregnancy. We had had a miscarriage the kind of cycle before, and because we'd kind of gone through that, we were entitled to an early pregnancy scan in this pregnancy. So we went for that around kind of, you know, what should have been kind of 7 or 8 weeks, based on my dates. Went in and they seen nothing. There was a gestational sac and that's all they seen. So we were really gutted. We left that. They'd rebooked us kind of for a week or two later just to confirm. And then went back and she put the wee Doppler on my tummy and there was a baby. And we were like, okay. So she also like took the measurements. At that early stage she was just kind of like, you know, it's hard to measure, but she estimated it at, I can't remember however many, like maybe she had maybe estimated it around like the 7 week mark then. And I was like, but that doesn't match up with my dates and things like that. So I kind of at that point kind of flagged, like, you know, the dates aren't matching up, and you know how they date pregnancies just didn't make sense because they just do it based on the size of the baby. And I'm like, but what if it's a small baby? You know, I can tell you exactly what my dates are, like. So anyway, the baby was there, they seen the heartbeat, so I kind of just booked into kind of like the normal pathway. Went for my 12-week scan. Everything was fine there. They seen the baby, they seen the heartbeat. This was kind of classed as a high risk pregnancy because in my first pregnancy I had an emergency section, and also my BMI was above 30. So automatically classed as high risk. I know kind of can be a touchy subject, but I went with it. It meant that all my appointments were seen at the hospital, and it meant I always seen a consultant at my appointments. So my appointments did take a bit longer. Literally every time I went to the hospital, I seen, like, I had a scan, I seen a healthcare assistant, I seen a midwife, and I seen a consultant. So when I had a hospital appointment, I was there for the day nearly. But I guess it was nice to get it all done in one go. So 12-week scan was fine, and then because of my BMI, I was offered gestational diabetes test. So that was, I think, around 27 or 28 weeks. So I went for that screening. It involved obviously the fasting, the drinking, the really sugary drink, and the 2 different blood tests, things like that. And then also a scan. So thankfully everything came back as negative for gestational diabetes on that test, and then they always kind of follow that up with another ultrasound, just to kind of make sure that there's no loads of fluid around the baby or things like that. So I think I was automatically booked in for that at around 30 or 31 weeks. So I went for that extra ultrasound and that's when they kind of started noticing some concerns around the baby's weight. So they were able to like plot his growth on the growth chart, and from like scan 1 to scan 2 he had kind of like dropped down a little bit. So what they then done was they brought me back in like the week, well, they were like, we'll rescan you in 2 weeks time to see how the baby's growth is, but what we'll do in the meantime is book you in for a scan to check like the blood flow through the placenta, just to make sure the placenta's working properly and there's no issues with the placenta. So basically I had a scan nearly every week from 31 weeks. 1 week was a growth scan, and then the alternate week was checking the placenta. And basically every time I went for that growth scan, the baby's weight was kind of falling off the chart. So the consultant was concerned. At no point did they pick up any issues with the baby's heart. They never really mentioned that it was a concern or like could have been an indicator in to congenital heart disease, so it wasn't picked up in pregnancy at all. So I went for a scan. It would have been at 34 weeks, and she said that she was going to start to prepare me for early delivery if the growth wasn't kind of catching up. And basically, like I said, every time we went for a scan, he was further and further down. So I got like the steroids injections to prepare the baby's lungs for delivery. My options for a natural delivery kind of like dwindled away. Just with all of this going on, the safest option was to have a planned section, which I really didn't want. I really wanted to avoid. And actually I might do a video on comparing like an emergency section and an elective section, because they were two totally different experiences for me. Now I know everybody's experiences are completely different, but I might do a wee video on that. If that's something that you would be interested in kind of knowing, then just let me know in the comments, and I'll kind of do that maybe in the next kind of couple of weeks. So yeah, I had the injections to prepare the baby for delivery. Went for so she said we would then decide at the 35-week scan. So went for the 35-week scan, and she herself, so the consultant herself, was like, I'm going to do the scan instead of a sonographer. And basically she was doing the ultrasound, and the baby's head was like breech, and then he was able to like fully rotate. So while she was doing the scan, he was able to like fully rotate, and she was just like, he should not be able to do that. Like there shouldn't be kind of enough room for them to be able to do that at this point. She kind of was classing it as an unstable lie, and restricted growth was kind of the reasons for early delivery. So I went for that scan. It was a Thursday, and I was 36 weeks the next day. So I was 36 weeks on the Friday. So she was like, have you brought your bag with you? She was like, I cannot let you go home. And I was like, I did bring my bag, yes, I came prepared. I was like, but I wasn't quite expecting to not be able to go home. I was expecting to have a section planned for maybe like the next day, but not that I wouldn't be able to go home. So my sister was with me for this appointment, thankfully, because sometimes I just don't retain all the information. So she was there with me, and we came out of the appointment, and I phoned my husband, and I was like, oh, just to let you know, like I'm getting kept in, like we're going to be having this baby like in the next kind of couple of days. They're going to get me booked in. The first thing he says to me, do you know how much it cost me to get the document? And I was like, I don't think that's the priority right now. Like, I'm having a baby. My sister phones my mum, and my mum's first thing, oh, she didn't get her hair done. And as you can tell, I've still not had my hair done. And I was like, people's priorities. I was like, I'm having a baby. I'm getting kept in hospital. So anyway, got kept in. I got taken to my own room. It was lovely. I delivered at Forth Valley. Such a lovely hospital. Would highly recommend it. So we were going into it knowing that we were having a premature baby, and our main concerns really was going to be his breathing in his lungs, because he was early. That was kind of my main thought. I had no other kind of inkling that anything else was going to be wrong. So we went in for the section. We knew that he would be seen by like a paediatrician kind of NICU team, that they would be there. So that was right, like they were there. I got a quick kind of hold with him, and then he got kind of taken away to NICU, and then I just obviously got taken back to kind of recovery. Thankfully I got taken back to like my own room again, which was just, you know, unexpected, lovely. It was a great service. And my room was right next to the like staff, like the midwife staff station, and then like literally at the end of the corridor was where the NICU was. So to be honest, I've really struggled with recovery from the section, which if I do the video comparing the two different types of sections, I'll kind of touch on it a bit more. But really struggled with that. So I was having to get wheeled to and from the NICU. Obviously in the first instance I was still in the bed because I was still numb from the spinal. And then on the couple of days after that I was in a wheelchair. Because I just felt so faint that they were like, you can't go anywhere by yourself. So I was like, right, okay. So Monroe was in the NICU. At this point he had no name. He was in the NICU. Yvonne, his NICU nurse, she was just amazing. Looking after him, looking after me, explaining everything to him. The NICU was just lovely. You had your own kind of like wee bay. You were really unaware of anyone else there at all. Family, like my mum, Harris, my sister, they all came in to visit. They were able to get into the NICU and see Monroe. So when he was born, he was put onto like a CPAP, which is like a wee mask that goes over his nose, and it kind of provides like high pressure up his nose to kind of keep his lungs opened. So he was started on that, and because he was in the NICU and on the kind of breathing, he was started with tube feeding, so he got an NG in, and obviously by this point I had no milk, so he was initially fed formula. We got offered donor milk as well, but I just went down the formula route because I knew that I was going to be expressing my own milk. So I had the joyous occasion of trying to hand express. Oh my goodness, it was so difficult. I actually had to get James to do it for me. He actually seemed to be quite good at it. And then like they gave us like the wee 1 ml syringes for like collecting the milk in. I remember when we got the first like full 1 ml syringe and James like pulled the syringe right the way back, pulled the insert out of the syringe and the milk lost, and I was just like, oh, that's my milk. But anyway, so that was kind of the Friday night, kind of into, I think most of Saturday I hand expressed actually, and then it wasn't till this Sunday morning that I started to, they kind of set me up with a pump. I really struggled with the hand expressing, like doing it myself. I could do it fine on one side, this side was fine, and I had a cannula in this hand. Now, anyone that knows me knows I hate anything medical, anything surgical. I can't do needles, can't do blood. Again, I can touch on that in this video that I do on the sections, but basically I had a cannula like here in my hand, and I felt it was really like the angle that I needed my hand to be at to express on this side was really freaking me out. And I was just like, I can't do it. And I was getting all stressed because I was like, my baby's in the NICU, I can't feed him, I'm struggling to produce, like I'm also like really weak and can't get there. It was just all sorts of emotions. But anyway, they wouldn't take the cannula out because of my risk of fainting. So that was really annoying. So I was glad to get onto the pump. So basically, the day we found out he had congenital heart disease was the Sunday. So he was born on sort of Friday afternoon, and then on the Sunday we found out. So I got up, kind of went to NICU in the morning, seen him, and then was like, right, I'm just going to pop back to my room, get myself something to eat and express. So I done that, and then I heard from, like I'd said, my bed was right next to the midwife desk. I'd heard them kind of put a call out for like pediatrics, and not kind of like a crash team, I don't know what they called it, but equivalent to that, putting out those calls. And I remember saying to myself like, oh, like, you know, that's such a shame, like something's happening to somebody's baby, never thinking that it was mine, because they were obviously in a completely different ward. So it was weird that the call was made in maternity. But anyway, didn't think it was anything to do with my baby. So I pressed my wee buzzer and I was like, I'm ready to go round and see Monroe now. Like, well, I wasn't called Monroe. Ready to go round and see my baby. I'm feeling ready. Can I just go by myself? Like, does the NICU need to know I'm coming? Like, how does it work? And the wee girl was a healthcare assistant. She was like, oh, I don't know. Like, I'm new here. I'll go and find out. So she came back and she was just like, oh, like, yeah, you can just go round, but they've asked if you can just go round in about 10-15 minutes because they're just dealing with a wee emergency. You know, she didn't make it sound like it was my baby. I didn't even think it was my baby. I was like, yeah, no worries. I think, you know, maybe about half an hour passed and I was like, right, do you know what? I'm just going to walk around myself. I feel I can do it. So that was the first time I walked around by myself to the NICU, pressed the wee buzzer to get in, and I was met at the door to the full ward by a consultant, and he was just like, oh, like, are you baby Fulton's mum? And I was like, yeah. And he was like, look, I'm really sorry to have to kind of like, you know, stop you here at the door. He was like, but I need to have a chat with you, like, your baby's really not well. Meanwhile, I'm standing like in the doorway to the department. I was like, okay, yeah, that's fine. Obviously in floods of tears. So he took me over to like the waiting room, just to the department. To be fair, it was quiet. There was nobody else there. I didn't see anyone else there. So whether Monroe was the only baby, I'm not sure, but it was quiet. And he had a chat with me about what he thought it was. So he kind of didn't go into like too much detail about how Monroe presented as being unwell. He just said that he had kind of took really unwell, and they've been working on him. They have done some kind of initial testing, which leads to them thinking that it was a problem with his heart. And they've started a medicine which they think will kind of, you know, help until he can get to the bigger hospital. So he told me then that he needed to be transferred. So the Royal Hospital for Children in Glasgow is the main hospital for cardiac cases in whole of Scotland. So regardless of where you live in Scotland, if you have a baby with anything to do with their heart, they will get seen there. So it's not too far from where we live. Forth Valley, where we delivered, is our closest, but it's maybe like an extra 10 minutes. So it's about 40 minutes from where we live to get to the other one. So he was like, the transport team are here, they're just getting them ready for transfer. So I think I was a little bit shocked that kind of all of this has happened and nobody's even came and got me. Like, you know, but at the same time, they've done what they needed to do for Monroe. You know, they had done all the tests, started the medication. He needed to be ventilated so put on a ventilator for transport. That was the safest way to transport him. So he was kind of basically talking me through all of that in the waiting room. And then another consultant came in, and she was actually somebody that I went to high school with, which I actually thought was really nice. And she came over, and you know, she said that she didn't need to have to do anything. She didn't need to have anything to do with me. She didn't need to kind of communicate with me if I didn't want to. And I was like, no, absolutely. Like, it's nice to have, you know, a familiar face through this. I was by myself, like I said, I was by myself. I knew James was on his way and he wasn't going to be alone. So I wasn't going to phone him and tell him anything over the phone. So I said to the consultant, I was like, you're going to need to go through all this with my husband when he gets here. So I don't actually know how James came in, like if he got stopped at the door. I don't think so. But he came in, and obviously there was a lot happening with Monroe. And by this point, I was just sitting in the bed bay across from Monroe. I was about to start expressing. And he came in and he was like, what's wrong? And I was like, oh, you know, floods of tears, something wrong with Monroe, something wrong with his heart. I was like, the doctor's going to come and speak to you. So again, the consultant, his name's Dan, so nice. He came back, went through everything again with James, And then at that point, that's when they were going to get him ready for ventilating. So they were going to start kind of basically like giving him really heavy drugs. So they kind of asked us to leave at that point. They put us into a family room. We phoned our family. So my mum came to the hospital, and my sister looked after Harris. So it was nice to have my mum there. She used to be a nurse. She used to work in paediatrics intensive care, so this was all kind of like familiar for her. And again, he literally the consultant went through absolutely everything again, what he thought it could be. So basically he thought that there was like a narrowing in his aorta, in the baby's aorta, which was restricting blood flow to the rest of his body. So kind of like limbs and organs is what was being restricted. So he was just like, I can't say for sure. He was like, but that's kind of what we think it is, and that's why we've started the medicine. They call it prostin. So basically, when a baby's born, they have their aorta kind of doesn't usually get used. I'm trying not to go into too much medical terms because I don't know a lot. The aorta isn't really functioning. They have like a duct that is opened, and that's what kind of circulates the blood whilst in the womb. Once they're born, that duct starts to close, and then that's when the aorta kind of kicks in. So the reason it took from birth to kind of a couple of days before Monroe started to present unwell was because the duct was still open and kind of gradually closing, and once it was kind of starting to close, he was becoming more and more unwell and more symptomatic. But because the duct wasn't fully closed, by starting this prostin, they were able to reopen it and reopen that pathway. So one of my big concerns, I don't know why, like when he was telling me all about the heart and stuff like that, I was just like, yeah, okay, no worries, like that'll get fixed. And I don't know if that was really naive of me to think that, but I was just like, I know, how good cardiac surgery is these days, so I was like, that'll be fine. I was like, my main concern at that point was his other organs. I was like, I don't, if he goes into multi-organ failure, what if one of his other organs is compromised and he maybe doesn't have, a functioning bowels or functioning kidneys. That was a huge concern for me at that point. He had also picked up that there was a certain bit of Monroe's spine hadn't developed properly. So he was kind of like explaining that, like, obviously the spine and the heart are kind of like in the midline, and he was like, so we've just kind of done like really initial testing to kind of find their reason as to why Monroe's took unwell. He was like, but you might find that once you get to Glasgow and they kind of start to look a bit further, that more things might kind of crop up in that midline, because when a baby's developing, it's their kind of like the midline obviously kind of develops at the same time. So there was that worry of, is there anything else? What else is going to get picked up? So Monroe was, at this point he was nameless, but we agreed that we really wanted to name him before he was transferred to the other hospital, just in case the worst happened and he passed away. So we agreed we wanted to name him. So whereas prior to that we had said we wanted to wait till he was out of NICU and we could properly see him before we named him. We had two names on our boys list that we'd kind of narrowed it down to, so it was either going to be Max or Monroe, and we were really still on the fence. Like we liked like the quickness of Max, but actually on the hospital wall there was like the most popular names this month, and one of them was Max, and we felt Monroe was really fitting to obviously now the situation that he was going through, the what was ahead of him. So that's why we went with Monroe, so as in like the Scottish mountains. So we're glad we chose that name. So he was named before he left and he arrived in Glasgow as Monroe. So he got kind of put into like a wee transport incubator, and sorry, I don't remember, put into a transport incubator, and he got kind of blue lighted from one hospital to the other. James followed behind, and he got there kind of shortly after. Bearing in mind, James isn't from here, so he has no clue, and was like, I have no idea where I'm going, no idea where I'm going when I get to the hospital. So he done so well. I was obviously not discharged from maternity services at this point because I had had the section and all the kind of rough recovery. I wasn't ready to be discharged yet. So the options for me were to kind of discharge myself and just go, or for them to transfer my care. So I asked for them to transfer my care so that I knew that I was going to be staying nearer Monroe. But they were just like, basically they didn't know how long it could take all night to get hospital transport to transfer me from one to the other. So what they allowed me to do was kind of discharge myself so that my sister could drive me to the other hospital, and then I got readmitted at the hostel that Monroe had been transported to. So I done all that, like transport myself, got readmitted. The staff at the other hospital, so the Glasgow hospital, they were really nice. I'm not gonna lie, the service wasn't great. Like the facilities just really weren't great, which kind of was just another kind of negative on an already negative situation. Like I instantly walked in and I was like, I don't want to be here. But I needed to be there because I needed to be near Monroe. Like, so that was kind of the only reason I'd stayed. They were completely miles away, completely different buildings from the hospital. And like I said, I really wasn't great on my feet, so and they weren't offering to take me, so I had to wait for James to be there to be able to take me back and forth. Thankfully, James was offered a room in the NICU. They had family rooms, so James was offered a room there, and they had said to me, like, you can just get discharged from there and come and stay here if you want. But because I'd had it was like a pull-out sofa bed, even though it looked great. I'm going to put a wee picture in. So it does look really nice, but not great for recovering from a section. So I just kind of opted to stay in the maternity services for a couple of nights. So this was a Sunday. We were transferred to this hostel on a Sunday, and I didn't discharge myself, but I was ready for discharge on the Wednesday, I think. So I stayed for a couple of nights just so that I could really just be close to Monroe, and we kind of got an understanding of what was happening. So as soon as Monroe got to NICU, he was met with obviously a consultant cardiologist who done an echo, so an ultrasound of his heart, and he was basically to confirm right there and then what he was seeing. So Monroe was diagnosed with coarctation of the aorta, which just means really narrowed aorta, along with a hypoplastic arch, which is basically you've got your aorta and then the bit that kind of leads up to the aorta. So it was a really kind of extensive, like really narrowed section of the heart, and that's why there was just no blood flow getting through. And he also has a large VSD, a small VSD, and a bicuspid valve. So they were all the things that were picked up, and we basically got told that he had to have surgery within, the next couple of weeks. Obviously, thankfully, the medicine he'd been started on was helping him, and he was able to kind of start to get blood flow and regulate his body again. Literally everybody at the Glasgow hospital, they sang praises about Forth Valley and how well they had done to pick up the heart condition and start the medicine. Otherwise we probably could have been facing further complications and further health issues for Monroe, so we're just so thankful for them. So yeah, that was kind of how it came about. I don't want to, I'm already conscious that I've been chatting for a really long time, so what I might do is do a video, my next video, on like our experience of the NICU. So basically Monroe stayed in NICU for 2 weeks before he had his heart surgery, and once he had his heart surgery he moved from there and he went into the paediatrics intensive care, so PICU or PICU, and that's kind of where he had all his care, between there and the cardiac ward. So I think I'll probably split that into like 2 different videos. I'm going to do a wee video on like our time in the NICU, and then our time from heart surgery onwards. So yeah, it's been a rough road, and again, like, you know, I just wanted to come on and kind of document our journey. It's not been an easy one. Lots of people ask us like, oh, like, you know, it's such a shame you didn't know during pregnancy and that it got picked up postnatally, and I was like, I'm not sure I would have wanted to know during pregnancy. I guess there's no real, you know, no situation's ideal. Both ways you're finding out your child's unwell, and needs surgery, so you know, none of the situations are great. The only difference would have been if we found out during pregnancy, as you know, wouldn't have been delivered early, he'd have been kept in as long as possible to kind of grow as long as possible, to get as big as possible. So and I would have delivered at the hospital where he was receiving his care, so I'd have delivered at the Queen Elizabeth Hospital and not the hospital that I delivered at in Falkirk, which, to be honest, I'm really glad I didn't. Like, the maternity services at the hospital just are not great, so I'm actually glad I had Monroe in Falkirk. And it's just, you know, so thankful that they were so vigilant, and his nurse Yvonne was so good at picking up his sort of decline. So yeah, I just wanted to come on and share that with you. I have kind of a lot more kind of like pictures and videos and things like that on my Instagram, so I'll link that below for you to follow if you want to go on and kind of see a bit more of our journey and like kind of pictures and videos rather than just me chatting. So yeah, if there's anything else you want to know about like the pregnancy or like the diagnosis, or anything like that, then honestly please just drop me a comment or like find me on Instagram, and you can message me on Instagram. It's not a problem. You know, the point of these videos is I want to be able to kind of help people and put our story out there and help people. I know I've kind of not touched a lot on his heart and the actual conditions that he's got, but I'm not medically trained. I don't want to be sitting here giving medical advice. It is more just kind of like our journey and our life through all of this. So yeah, thank you so much for watching. If you've made it to the end of the video, I can see it's a long one already. But yeah, please just drop me a comment if there's anything you want to know, anything I can help with. And like I said, I'll do those next couple of videos following on to kind of, you know, what happens next for Monroe with NICU and surgery and things like that. So thank you so much. For those of you that haven't already, then like and subscribe. Thank you.